We got a couple parts that actually looked more like anterior pituitary than adenoma. We'll go right to the adenoma. You can see some hemorrhage there, not too much on the place that I've decided to photograph, but monotonous cells, no pituitary architecture to speak of. We did find mitotic activity. I'm not as happy with how this is projecting as how it looked on the scope, but you'll have to trust me. That's a mitotic figure there. This one looks much better. There's one there. And this always worries us. We're not really used to being able to find them so easily, and these were pretty easily found. The hormone studies, like this, FSH and LH were felt to be negative. ACTH was felt to be negative. Prolactin and growth hormone had some reactivity, and I'll get back to that with larger pictures in a moment. TSH was negative. P53 was felt to be mildly elevated. I'm again going to go back to that. And the Ki67, as you can see, was elevated more than we like to see in a typical adenoma. This is the prolactin. It was read out as being a globular perinuclear staining, which is pretty easily illustrated on this slide. And this is the growth hormone stain. We called it positive, and it's definitely positive, very minute punctate perinuclear staining. So maybe it's not surprising you never manifested any symptoms or labs to reflect that, but it's there and it has to be called by us at least. This is the P53, and if you look closely at this, usually on a stain like the Ki67, we only interpret cells that are nice and dark. On the P53, they really only have to blush a little bit, and if you look and count all the ones that have any staining at all, it gets up to about 30 to 40% in some places, so that we felt to be elevated. And here's the Ki67. We signed this out as focally 4 to 8%, and I think the feeling or the consensus is anything above 4% is suspicious. So when we did this addendum, we suggested that it's consistent with an atypical adenoma and it needs to be followed quite closely.